Good morning. I'm Daniel Smith, President and CEO of Cooperative Network, a nonprofit cooperative trade association supporting cooperatives from a dozen sectors in Wisconsin and Minnesota. Thank you for joining us today for a discussion on strategies and trends in employee benefit programs, a topic of high interest for cooperatives of all types and sizes. Today's webinar will be led by a team of experts from M3 Insurance. M3 Insurance is a longtime supporter of Cooperative Network and cooperatives around the country. Based in Wisconsin, M3 is a privately owned and independent full-service insurance broker specializing in property and casualty, employee benefits, and risk management support. Since 1968, they have helped employers create personalized plans that integrate competitive features with strategies that control cost and keep you compliant. Thank you for joining us today, and thank you to our sponsors for supporting this webinar. I'll now turn it over to my friend and colleague, Jen Pino-Gallagher, Director of Food Agribusiness Practice with M3 Insurance. Jen?
And thank you very much for that introduction. Very kind of you. It's a pleasure to be able to speak to everyone on the webinar today. Thank you for joining us. And I would say that while each of your operations are unique, either in the geography you're serving, I think we have participants from multiple states today, Wisconsin, Minnesota, and Iowa. So while you may be unique in the geographies you serve, as well as the members you support, certainly the one commonality between every single employer and cooperative on this call is the need to recruit and retain great employees. And with the pace of change increasing, it can be head spinning to stay current on what's happening in the employee benefit space. So we're very happy to be with the Cooperative Network team today to share some of the trends that we are seeing in the cooperative benefit space. Our first presenter is my colleague, Gretchen Flickinger. She's going to talk about the three main trends that we are seeing in the employee benefit space and share some strategies for utilizing those trends to your advantage. Our goal today is that you can take away at least one item that you can take away that can be actionable within your organization and help affect positive change. If you can take one item away from today's webinar, we'll feel like we've done our job. So as I mentioned, Gretchen will kick off the presentation today. She's a client executive at M3, and she specializes in employee benefits and oversees and manages benefit compliance, strategy, design, and implementation for employers and cooperatives across the country. She has a really interesting background. She's actually a lawyer by training. She earned her Juris Doctor from DePaul University College of Law, and worked for several years as the Director of Compliance for Employee Benefits at a consulting firm in Madison. She'll be kicking off the presentation today, and following Gretchen, who will be discussing the trends in employee benefits, will be our colleague Connie Perry. She's going to be talking about what she's seeing in the pharmacy world. Connie is well-versed and well-prepared to share information today because she's our Managing Director of Pharmacy Solutions here at M3. She earned her doctorate degree in pharmacy. So as you can see, she comes well-prepared from the University of Illinois College of Pharmacy. She's a wonderful person to work with. In her role, she helps lead our pharmacy solutions team, and she uses her clinical background and decades of experience in the PBM space to offer a comprehensive solution for our employers. She also has been involved in some very large and important projects, including key positions in the launch of a pharmacy benefit manager PBM program at Walgreens Health Initiatives. Without further ado, I'm going to ask Gretchen to take over the virtual screen here and kick off our presentation for today.
Sure. All right, hopefully that is sharing for everybody. Good morning. Thank you so much for having me. Looking forward to spending about 15 or 20 minutes going over some strategies and trends in employee benefits this morning. As Jen mentioned, I'm Gretchen Flickinger. I'm the Director of Employee Benefits from our Madison office of M3 Insurance. HR teams are shifting their strategies to provide the support that cultivates a high-performing and engaged workforce. 79% of US-based employees are concerned or very concerned about the rising cost of healthcare. In 2024, employees are offering a variety of employee benefits to attract and retain a multi-generational workforce. Employees will leave for better pay, better work-life balance, better learning and skills opportunities, and better health benefits. They will stay for better health and well-being benefits, great manager support, simply loving what they do, their company's brand and reputation, and their team. Based on that, we have identified 3 trends driving the market that we will review and discuss today. 1, technology's role in total rewards landscape. 2, health plan funding, looking for transparency and alternatives to traditional models. And 3, the health and well-being of the workforce. The role of AI has exploded in the employee benefit space. It is the integration of analytics and AI that helps a company better understand trends driving the market. Gathering peer data via surveys can provide valuable details on what employers are offering in terms of total rewards. Here we can share what your peers are providing for traditional and voluntary benefits, work-life balance benefits, salary and retirement, and medical plans and health analytics. Adopting some of these trends can boost your overall benefits offering, increase your market competitiveness to become the employer of choice in your community. With this data, you can integrate analytics and AI at every step. Data's integrated role enables you to be set apart with high-value services. Regular oversight and access to utilization and pharmacy trends, real-time benchmarking of pricing, and comparison of plan costs are just a few of the areas that AI provides employers within this current landscape. This screen is busy, but I'll break it down. I accessed M3's AI platform and pulled data specifically from the industries that I identified as attending this webinar. The next several slides show what employers are providing to their employees in your specific industries. This slide shares the traditional and non-traditional benefits being provided to on an employer or employee paid basis. Since the dashboards are full of data and are a bit small and crowded, I pulled out and highlighted a few facts that I found insightful for this webinar. To note, 62% are providing some sort of education or tuition assistance programs. 37% are providing wellness perks, and 93% are offering voluntary benefits. So think accident, critical illness, hospital indemnity type plans. And 90% are offering some type of an employee assistance program. That's an important offering that I'll touch on in a few minutes again later in this presentation. Work-life balance is becoming even more important in the current post-COVID workforce, with Gen X, millennials, and Gen Z employees all coming together at one place of employment. It means something different to each generation, and employers need to recognize that. To note, most employers are offering 21 to 25 days of PTO, with 26% having some restrictions or minimal time off during the first year of employment. 78% have implemented a tenure-based escalation policy, and almost all offer holiday pay, paid time off, and bereavement leave. Slightly surprising is just 64% offering some maternity leave. We continue to see a slight uptick in paternity leave policies. And 79% of your industries have role-based work from home limitations. This slide is on salary and retirement trends in your industry. This is a huge component of work satisfaction for employee retention. As previously mentioned, employees, often younger generations, can be quick to jump employers over salary. To note, in your industries, 89% are currently offering a 401k plan with an average merit increase in 2023 of 3.7%. Salary review continues to occur annually for 61% of employers who participated in this survey. Our AI data also allows us the ability to analyze health plan data in real time to compare plan design and plan costs. This slide is averaging the plan design statistics of the industries that registered for this webinar. It is showing an annual average deductible of $2,500 for a single and $5,000 for a family, with max out of pockets at $4,500 and $9,000, with an average cost per employee per year of just over $14,000. AI allows platforms to drill down and show median copays, ER fees, lab fees, and more. You'll see medical RX averages, median annual employee contributions to HRAs and HSAs. Lastly, this slide shares the plan metrics and how trends were seen in your industry. In the last 5 or 6 years, the median deductibles in your industries have gone up from $1,500 in 2017 to $2,500 this year. Likewise, the median max out of pockets have increased from $3,000 to $4,600 during the same time frame. During that same time frame, the coinsurance has dropped from 90 down to 80%, where it's consistently stayed the past few years. Next on is to trend 2, which is alternative funding and shifting attitudes. With 79% of employers concerned about the rising costs of medical plan costs, it makes sense to engage in cost management strategies. In fact, the cost of healthcare often dictates the budget for all other total rewards you're able to offer as an employee. The health benefit portion will continue to eat up most of the pie, with healthcare costs rising at 3 times the rate of wages and 4 times the rate of inflation. Lower retention, declining engagement, upticks in lawsuits against employers, and disconnect in communication between the employer and employees all contribute to issues employers need to face head-on. Understanding your population and finding effective ways to engage and communicate with all employees is a great step in creating that connection that is needed to prevent reputation damage and ensure that your employees' perception is reality. Defining your goals, creating a strategic plan, and activating an effective team with accountability measures in place can help you find success. Industry trends that have been becoming more common and effective are listed on this slide. Areas like direct primary care, specialty pharmacy carve-out, on-site and near-site clinics, advocacy solutions, and gene and cell therapy cost containment have all been effective methods of cost containment. With increased access to data and transparency, employers and their broker consultants can partner and identify trends, high-cost claimants, and emerging new claims to deploy the appropriate programs and partners to contain costs. In communities with access to direct primary care clinics, plans can find significant cost savings and increased employee satisfaction when this becomes an option. Similarly, on-site and near-site clinics have helped employers become the employer of choice when they have created access for these employees and their families. Employers continue to seek out alternatives to the traditional fully insured medical program. This health spectrum lays out options employers can consider and analyze to determine the best program for their employees. Employers need to consider their risk tolerance, budget, population size, and appetite for potentially big change. This spectrum ranges from fully insured health plans with the carrier taking on the claims risk to level funded programs, self-funding with actuarial determined rates, the consideration of adding focus networks and direct provider contracting to reference-based pricing models. Employers can work with their brokers to determine which programs will be successful in their community based on their hospital systems, access to care, and networks. The desire for more data and transparency will keep employers open to consider change. This slide just depicts a handful of the expansion that we have seen in healthcare options. As a broker, it's our responsibility to stay on top of the market and emerging leaders, providing cost savings and a better employee experience. One large area of growth that we have identified has been in the health captive space. National compulsory data of leading captive managers shows captive growth at an annualized trajectory of 35% over the past year. As a case study, as an example from M3, in the past 4 years, our captive business has doubled every single year. What is driving captive growth? As groups consider changing their funding strategies, it's important to consider what specifically is driving this growth. In recent years, there has been a consolidation of traditional insurance markets, limiting the ability of employers to market plans to multiple markets. High rate increases in unstable markets have created unsustainable situations for employers. These markets tend to have a lack of transparency and flexibility, leading to the emergence of innovation in the market. For captives, groups of like-minded employers have emerged with the desire to partner and hopefully find more control over performance and best practices. If you dedicate time, energy, and resources to making a shift in your funding model to improve your overall health plan, it is just as important to then effectively convey the value of your benefits to your employees. Creating a strong foundation in the strategic planning is key upfront. This allows you to develop your plan and program and implement your messaging, technology, and outreach effectively. There are tons of tools and resources that can be launched to appropriately convey the value of your benefits to all members of your employee population. You should take into consideration language barriers, location of employees, and generational differences in how they prefer to be educated and what methods prove to be the most effective. Finally, the strategy needs to be reviewed and evaluated to ensure efficiency and continue to reinforce the value of your program. Essentially, you should keep a scorecard. The third component of my trends presentation is the health and well-being of a more diversified workforce. There's no more one-size-fits-all in the employee benefits world. Older generations are continuing to retire, and some taking a ton of corporate knowledge and experience with them. Employees want purpose in their careers and will leave without it. There is an increase in financial, physical, and emotional burdens throughout the workforce as well. This slide speaks for itself. When health declines, everything in the workforce takes a hit. If an employee is experiencing something, there is a 28% decreased commitment to the employer and a 69% decrease in enthusiasm. An employer can create value and meaning through well-being programs to support employees at every stage in their life. As I previously pointed out, in your industry, 90% of employers are now offering at minimum an employee assistance program or an EAP. This can also include addressing retirement gaps, caregiver support, family building, and career development. An employer's goal can be to foster holistic well-being. This can include work-life balance programs, financial and emotional well-being support, mental health support, live life well accounts, and flexible work schedules. Make your program personal. Personalize your message and simplify it. Customize benefits solutions focusing on whole person health, which 95% of employers believes improves the employee experience and increases retention. Ensure there's access for all employees. With good strategic planning and mission development, you can maximize your resources and expand your current offerings. Deploy an education program that reaches all employees that will provide an approach with the best results. There are so many options for campaigns and communication strategies. Finally, employees and HR teams can experience vendor fatigue. Find ways to simplify for easier access by properly selecting your vendors. A holistic and comprehensive well-being program will not ignore financial wellness. You should align your wellness incentives to include financial health. As an example, participation in learning opportunities. Move education away from investment and retirement, which only 8% of respondents want to hear about investments, to other core financial values like budget, debt, and family finances. And then provide multiple resources for learning, on-demand, video and virtual, and on-site, group and one-on-one meetings. Targeting populations of varying ages and points in their career requires highly personalized and tailored experiences. You can use your clinical data and medical and RX claims to have more access to data to drive disease management opportunities. Biometric screening data can also be used, but we have seen a shift into employers encouraging PCP visits and creating stronger relationships with their PCP. The employee experience can be measured through health and well-being surveys, net promoter scores, scorecards, and more. The goal in the end is to reach all employees, listen and communicate, and take action on your healthcare programs, well-being programs, and total rewards programs. And finally, what does the future hold? We'll see continued growth, focus on employee engagement, continued innovation with AI and technology, more players in the market, and more specialization, niche, and exclusive offerings.
You, Gretchen.
Yeah.
So I'm going to get started and flip a little bit to the pharmacy only section of the presentation, and look forward to hopefully providing some really good information in a very dynamic space.
Connie, do you want me to do the slides, or do you want me
Oh,
to?
that'd be great. Yeah.
Okay, sure. Okay.
Like it's not moving on my end. All right, so let's talk a little bit first about all the statistics and the trends that we see in pharmacy. And I think the audience probably recognizes the dynamic of the benefit right now. So there's a lot of statistics on this particular slide. I want to just speak to a few of them. First and foremost, when we think about what's happening in the pharmacy benefit space in terms of cost and trend, we are seeing it hover around that double-digit numeric, if you will. So pharmacy is continuing to increase year over year between 6 and 10%. What drives pharmacy trend is one of two things or both. It's either going to be the cost of the prescriptions that your members are taking or the utilization. So the number of prescriptions, obviously the volume of prescriptions that members are taking, or both. So we know in the space right now, we have the dynamic of both inflation driving cost, as well as new drugs coming to market that are very expensive. And the volume is going up on a regular basis too. So utilization last year was about 6% up. And again, on the inflation piece of it, it was almost 5%. Now, a lot of what's driving cost is the component of pharmacy that we refer to as specialty drugs. You'll see in the upper right-hand column here, I guess, is the red box that says the average annual cost of a specialty drug is about $84,000. So very significant. This is basically saying that the member that is on a specialty medication that takes a script every month for a year is probably going to cost your plan about $84,000. We're going to talk a lot about specialty today because it is one of the biggest dynamics that we are trying to manage in the world of pharmacy, and clearly specialty does need to have a strong focus on it. Another thing that I want to mention on this slide is the navy blue box. We're going to talk about GLP-1s as well. That's another significant concern in terms of cost in the space. And the GLP-1s, you may not recognize that nomenclature, but I'm sure you all recognize Ozempic, or you've got Mounjaro, you've got a lot of drugs Wegovy, that you've probably heard of or have seen in the press, etc. Those medications to treat type 2 diabetes and weight loss are significantly impacting the pharmacy benefit. So I want to mention that, and we'll talk a little bit more about that. But if you do add coverage for that particular category under the pharmacy benefit as it relates to weight loss, it can have a significant impact on your spend. It can be about 5% of the total drug spend, or about $14.50 PMPM for just that therapeutic category. Gretchen, if you want to move to the next slide, please. So obviously we know cost is an issue. And again, I kind of talked about the drivers, but another component that is interesting in the world of pharmacy is just how complex and opaque it can be. And so again, there's a lot of focus on being a wise consumer, if you will, as a plan sponsor, in terms of how you would like to contract and provide the benefit with a partner, such as a pharmacy benefit manager or a PBM. So a couple of things I just wanted to call out here, again, that makes our lives pretty busy as it relates to pharmacy is just the complicated drug distribution channel that we're faced with here in the United States. There's a lot of players in the mix. You have wholesalers, that are distributing drugs, the manufacturers that are producing them, the PBMs that are obviously adjudicating the claims. And all of this then means we need to get the right drug into the hands of the member at a very affordable price. And there's a lot of misaligned incentives and certainly revenue channels that we want to just be aware of and contract correctly to make sure you can feel good about what you're offering your members and, again, who you're partnering with. So we spend a lot of time with our clients, making sure that you know what you're buying and how you're buying, especially as it relates to your pharmacy contract. So we'll talk a little bit about that. A couple of other things, though, that have happened in the space recently. We do have Florida that it kind of came into play from a legislation perspective, saying, we think it's important to offer the ability to import drugs from Canada, because we know in Canada some of the medications are the same as produced in the US at a much lower cost. So a lot of questions coming in regarding, do we as a plan sponsor want to also allow for reimportation of meds at a lower price through Canada and similar situations. So that's, a very interesting dynamic. Some drug shortages that are a great concern, for me as a pharmacist, making sure, again, that my clients are getting the meds that they need. Some of the drug shortages, the GLP-1s, like the Ozempics, et cetera, just based on supply and demand, we're seeing some shortages there. And then for the last 1 to 2 years, we've had some really difficult situations being able to find medications for attention deficit. And that's been really concerning as well for those members, often children that need access to those medications. The last thing I'll just talk about on this slide, and Gretchen alluded to it a little bit, a few months ago, we saw a class action lawsuit against Johnson & Johnson, obviously a very large organization and employer in the United States. They actually were litigated against their employee base for allowing their contract with their pharmacy benefit manager to basically allow or not allow, I should say, access to the lowest cost medications under the plan. So members were finding access to low cost items that they would have to go if they wanted to pay the least amount, they would go outside of the plan to acquire. And that is obviously of great concern. So the employees basically said, the contract that was executed, was something that J&J should have been aware of, their PBM was aware of, and their consultant was aware of. And we think it's really, an important class action lawsuit from the perspective that it does reiterate that plan sponsors ultimately, have a fiduciary responsibility to contract with the best PBM that they can in a very transparent way and understand, what they're paying for and how those claims are adjudicating. And that it's really important that members have the right to be able to access and find, very inexpensive medications and have those covered by the plan. All right, Gretchen, you can go to the next slide, please. So with that in mind, again, the complexities that we're seeing in the space and cost, it's important, we believe that, again, plan sponsors are looking at the space in its entirety. And there's a lot of players in the US. And sometimes I find that our clients maybe underappreciate how many entities there are out there that are managing the pharmacy benefit. So well over 100. If you look at the big players, the top 6 PBMs actually manage 96% of the pharmacy business in the United States. Now, it is important because Leverage makes a difference in the world of pharmacy. So the bigger the organization, the better that PBM can negotiate on the price. However, if we're talking about the big, the big six controlling 96%, then you've got over 90 other entities that are in the business as well. And there's a lot of value to looking at those organizations as well and understanding the value proposition that they may bring to the organization. And so we like to talk about, those differences and those different types of contracting entities. So I like to just kind of bucket them into 4 different areas. Obviously, you've got, the big players that most folks are aware of. The big 3 are basically Express Scripts, CVS Health, and Optum Rx. They can provide both spread and pass-through contract options, which I'll talk about in a moment. But we have a lot, in blue, what you'll see at the bottom there is we have a lot of transparent PBMs that very much believe in passing through the value of the price as they contract with it. Then we have in the upper right, the green, independent pharmacy coalitions. These are entities that, again, are structured on their own, and they band several employers, not several, but it could be many, could be hundreds, right, of employers together. And then they leverage that size of the drug spend to get really aggressive pricing that looks like maybe what a big 3 PBM can offer. And they can provide some really nice value and different, program options, customized approaches to managing care, et cetera. And we think that they, can be a really nice option for plan sponsors as well. So we look at them. And then finally, the orange is the integrated PBMs. And this is where we are seeing some value come through because you're pooling in the pharmacy with the medical administration, and there can be value there from efficiency, from being able to really educate and motivate physicians to prescribe according to the formulary. And there can be efficiencies on, cost, et cetera. So definitely we're seeing the pendulum switch a little bit from carve out back into an integrated system, if you will. So again, a lot of choice, but a lot of really good education that goes behind who may be the best fit for an organization. Go ahead and change slides. Thank you. All right. So, I keep mentioning transparency. This is, right now, candidly, probably overused in terms of terminology right now in pharmacy, but honestly, it's for good reason. And one of the aspects we're going to talk about in a little bit is going to be all of the legislation that's happening right now in the world of pharmacy. And a lot of that proposed legislation or the legislation that has passed relates to transparency in PBM contracting. So there are states right now, as an example, that require the PBM contract be transparent. And that basically means 2 things. One, if a member is filling a prescription at retail, that claim should adjudicate or process as that PBM has negotiated with that retail pharmacy. That was not always the case. So that's what we consider to be, pass through at a retail pharmacy, as an example. Another big aspect of transparency is on the rebate side. And that is suggesting that when a PBM is contracting with a pharmaceutical company to get rebates on brand or specialty medications, when they receive that rebate, it should be passed through to the plan sponsor because it's based on your utilization, your members' utilization. And full transparency on rebates was not always in play historically as well either. So those are 2 really good examples of, where, again, legislation is occurring to kind of mandate it, or you want to, as an educated buyer and fiduciary, look at the contract to make sure you understand, is it transparent? Is it not? And if it's not, what does that mean? And are you comfortable contracting with that vendor? All right, Gretchen, you can go to the next slide. Okay, so we're going to move from, again, kind of what's happening in the space in terms of dynamics with cost and transparency, et cetera, to some of the biggest topics of concern, if you will, under the pharmacy benefit. So, number one, absolutely is going to be specialty drugs, because it is the highest area of cost that we see today. And I'm really going to focus on the outpatient pharmacy benefit here, but I do want to be clear when we move to gene therapy, and we talk a little bit about gene therapies, they're under the medical side. So we still really want to make sure that if we're thinking of specialty drugs holistically, that there is spend under medical and pharmacy. In terms of some of the statistics on this slide, however, if you're looking at your total spend under the pharmacy benefit, usually what we're seeing is that 50 to 60% of that pharmacy spend will be associated with specialty drugs. But what's interesting about that is that the claim volume itself is actually very low. So 50 to 60% of the spend is probably only driven by less than 2% of your prescriptions. So just a few claims are really driving a spend, and that gets us back to that $84,000 on average is the cost of a specialty drug. So managing specialty should be at the very top of your priority list when it comes to, strategy. And because of the cost and the need for some of these medications that really can manage very, rare or less common conditions, pharma's very interested in producing these medications. So if you look at new drug launches, this is the pipeline that we're also seeing come through. So 2/3 of new drugs that come to market are specialty medications. And just to kind of bring to fruition, again, if you're, not familiar with what is a specialty drug, it is different than a traditional medication like that you can kind of produce through a recipe of sorts. Lots of specialty drugs are actually injectable. They're very difficult to manufacture. They can actually be a live organism, a protein, etc. And so that's why there is a very high cost associated with them. And if it's an injectable, it requires supplies, administration technique. Sometimes they need to be refrigerated and packed on ice and shipped. There's a lot of complexities to that piece too. So there's a care coordination effort that needs to be, considered in the overall scheme of specialty drugs. So Gretchen, if you go to the next slide, I get the question a lot, wow, we have a huge cost issue here. Is there a way to manage specialty drugs? And this slide, I recognize it has a lot on it, but I think it's important to recognize there's a lot that can be done by a plan sponsor to make sure that you're managing specialty drugs and cost to the best of your ability. So I call this the specialty drug waterfall, if you will. There's 3 different kind of spectrums of management when I'm helping a client manage the cost of specialty drugs. One is, I want to look at, well, how does that member access the drug itself? How are we contracting on price and rebates for that specialty medication? And if that medication is the right medication for that member, how do we best manage the drug clinically so that there's no misuse or overuse and all of the components that go with that. So it's really important that you kind of recognize again that there are levers that can be pulled, and it goes along a spectrum. Just as Gretchen kind of spoke to the spectrum of funding the benefit, I think there's a great spectrum of opportunity when it comes to managing specialty drugs. So just a couple of things that I see as kind of low-hanging fruit, if you will, would be things like site of care, making sure that folks are getting these medications at the lowest cost site of care, using exclusive channels if they make sense. And exclusivity usually brings about a more aggressive discount and possibly rebate associated with those medications. Looking at your contract is very, very important, making sure that you're getting the best price that you possibly can on certain medications. Sometimes that means, you know, carving out. It may mean negotiating differently. It may mean looking at copay assistance programs, leveraging monies that the pharma companies have available to lower the cost of the drug for both the member and the plan. And then I can't reinforce enough how important the clinical management component is. If it's a specialty medication, most likely it needs to be monitored and assessed on a drug by drug basis. So prior authorization, making sure that, you know, if it's a weight-based product, that there's the, you know, assessment of that person's weight on a regular basis. Biosimilar strategy is incredibly important right now. You're probably familiar with Humira, that lost patent last summer, and we have multiple biosimilars out now on the market, and just making sure that we're moving folks to those lower cost items. And just recognizing that it's okay to almost overmanage in this space because of the cost dynamic, but still ensuring that your members get these medications because they are life-saving and they also enhance productivity in the workforce. Next slide. All right, so I get the question a lot, and I wanted to just spend a minute on it. You know, where does gene and cell therapy fit in the world of pharmacy? And it is definitely in the world of pharmacy. I kind of mentioned this earlier, but I want to, you know, reiterate it again. We talked about specialty, you know, therapy. A lot of the specialty drugs can be processed under the pharmacy benefit, but we certainly have the, you know, the component that is gene and cell therapy as well. These medications are going to fall under your medical benefit and will show up under, you know, that reporting, if you will, or that benefit. In its most simplistic terms, I like to just define gene therapy because you may not, you know, understand what it means. But when we think about our own DNA, our own structure that makes us individual, you know, we have genetic makeup that allows us to be healthy or potentially missing something that puts us at risk for a certain condition. In general, gene therapy is the ability to correct a genetic mutation that gives us a disease. And most of the diseases for which we have gene therapy now are very, you know, upsetting conditions. They usually cause fatalities. These individuals are born with a genetic mutation and they cannot thrive. You know, they pass away often in childhood. So these are absolutely phenomenal breakthroughs in medicine because they literally correct something that's missing or correct a mutation that is causing disease. Unfortunately, when you're looking at how specific it is to get to the ability to have gene therapy, it absolutely comes at a dramatic cost. Gretchen, I'll have you move to the next slide. So when I'm talking about cost, I'm speaking to seven-figure amounts. Most gene therapy right now, I think the least expensive that's on the market is running about $800,000 for gene therapy. And this is just usually a one-time thing. Like you go in, you have the you know, the infusion done, if you will. That gene therapy is a dose. It's not something that you're taking again on a monthly basis, lifelong. So the costs are substantial because of that. But anywhere from $800,000 to the most expensive drug in the United States today is also a gene therapy. It's $4.5 million for the dose. It's a drug called Lenmeldy. And again, breakthrough medication that was released or approved by the FDA just a few months ago. So the question becomes, how do I afford a gene therapy if it hits the plan? And again, these medications are associated with conditions that are incredibly rare. So many organizations will never see a claim come through, but it's very important to talk to your advisor and your consultant to make sure that you are, contemplating what would happen if you had a claim. So in terms of coverage considerations, the most popular has been to just make sure gene therapies, would be covered under stop loss. And we see a variety of entities that have stop loss arrangements for gene therapy. But there are other things that you can think about. There are ways to negotiate direct with the manufacturer. There are centers of excellence, which I think is a very viable and important component here. And these are organizations that may have good experience with the gene therapy and good quality of care, and you can negotiate direct with those providers, and then also payment plans where you can negotiate, performance guarantees, if you will. So again, a couple of things to consider here, but definitely something that needs to be a topic of conversation and coverage, because we do, again, have quite the pipeline for gene therapy. And for some of them, they're going to be applicable to folks with sickle cell anemia, hemophilia. And so there is a long-term benefit opportunity there for correcting a condition versus pain, very high claim costs every year for a lifetime of that member. And that's really the consideration and the benefit that you need to think about from a cost perspective. Next slide, Gretchen. All right, so we're going to move into GLP-1s. Again, these are, for the most part, I'm going to try to concentrate a little bit more on the weight loss coverage piece of it, because, as a pharmacist, first and foremost, I'm going to tell you these medications work really well and have a place in therapy for the management of type 2 diabetes. Our concern with the space right now is, do you as a plan sponsor cover them for weight loss, which some are indicated for? And the reason why they're so popular is, the statistics that we see on this particular page. So here in the US, without a doubt, we are an obese society. So very high percentages of folks that are either considered overweight based on their body mass index or are obese and may have, a BMI that makes GLP-1s applicable or approved, if you will, for weight loss. And next slide. So in terms of management, I think it's really important that, first and foremost, you think about what is your philosophy regarding healthy living and what you're providing as a benefit to your membership in the realm of weight loss. So before I recommend to a client, would I say you cover these or not? I usually first say, well, let's talk first about your philosophy. Like, are you already using someone for wellness today? Do you cover gastric bypass surgery? That is actually considered a very cost-effective option for weight loss. And so you want to think about, again, the overall benefit that you're providing and what that looks like if you add coverage. I have clients that don't cover any weight loss drugs today. So if you're not doing that, I wouldn't necessarily say cover GLP-1s immediately, because you're not even covering the drugs that are on the market today for weight loss. So just things to, again, kind of consider and have a strategic conversation about. Why, again, do we worry about GLP-1s? It is cost is a huge concern. The average monthly cost of these medications are running about $1,000. So very expensive. And candidly, what we're seeing in literature and the research is that if folks do stop taking these medications, the weight will come back on, they will rebound. And so these are going to be considered maintenance medications, and the use of them will be long-term. So $1,000 a month long-term is what, you know, we have to think about. Next slide, please. So just wanted to kind of throw out the GLP-1s that are on the market right now. The most recent is the one that's listed last, Zepbound. Be assured, most pharmaceutical companies are all over adding these to their pipeline. So they want to get in the race and have some products themselves. But what's interesting here is you're going to see some that have been on the market for a long time, that really have been used for type 2 diabetes. But what has happened is when these drugs came out for type 2 diabetes, and then we saw the side effect of substantial weight loss, the pharmaceutical companies obviously went to the FDA for approval on that indication. So if you look at like Ozempic and Wegovy, which are highlighted in orange, and Saxenda and Victoza, which are the darker pink, if you will, those are actually the same chemical entities. So it's where pharma said, you know, we're going to take the drug and we've got type 2 diabetes as the indication. And now we're going to market it separately, same drug, same chemical entity. We're going to market it for weight loss. So it's just a really interesting spin that we're obviously seeing the pharmaceutical companies take on. The other thing to consider as just you're perusing this chart is that there are other indications coming out, things like cardiovascular indications. There's some thought that we'll see sleep apnea, an indication for sleep apnea, and other comorbidities that I would say, or indications for which you can see a higher propensity of because of being overweight. And so again, with weight loss, you are hopefully alleviating or managing other conditions better, if you will. And so we're going to start to see more and more indications. Next slide. So considerations for coverage, I'm going to focus just on the red call out here. As I said, you know, just taking a step back and thinking about your overall philosophy and your strategy is going to be important. And then if the decision is that you do want to cover these medications for weight loss, I think it's very reasonable to really fine-tune what is important for you in terms of a holistic kind of prior authorization, you know, or coverage dynamic. You know, working to make sure that that person truly is, you know, overweight or obese, that they have failed the attempt of diet and exercise, that you are, you know, managing the drug from a quantity limit perspective, that they are enrolled in behavior modification programs or healthy lifestyle, making sure that, you know, there's a lot of components here for the best appropriate use of these medications to make sure that it is, you know, worth, again, the long-term cost. So this is where I see a lot of organizations, again, focusing their efforts if they are going to cover the GLP-1s. Next slide. So the last part of the presentation on pharmacy in particular is talking to legislation. Again, I know I mentioned this earlier, but it's really important that you recognize that this is a incredibly dynamic aspect. In fact, if you look at the kind of the text at the bottom here, just in 2023 alone, there were more than 650 bills that were proposed across the country that had some sort of a pharmacy spin on it. We do expect a similar frequency and interest this year. In general, the four aspects of legislation that is in play right now across the country, and most of this right now is in play in Madison right now too, being reviewed for passage, if you will. But the things that are being, you know, reviewed for pharmacy is eliminating preferred network options. So you would have to allow access to all pharmacies. You couldn't say, you know, just go to CVS or, you know, just go to Walgreens and a few others. That the whole preferential opportunity to customize networks is going to be an issue and is an issue in some states right now. That can tie in to specialty exclusivity as well. There's a lot of contracts that say you must fill the prescription for a specialty drug through a certain facility. And we are seeing where that is being removed as an option in some states. Similar mail order, you can't necessarily in some instances require or even heavily incent folks to go to mail order to fill their prescriptions. All of these, unfortunately, can actually increase your cost. Because most of these, what you're doing is you're routing folks to what could be a lower cost option through the discounts and the, you know, the contract that you've negotiated. So I get concerned because some of these are the things that we've done to help manage cost over the years. They could be repealed and peeled away. And you can see there's cost dynamics to each of these. This happens to come from some CVS Health that did actual research on the cost in those states for which these requirements were in play. And then pharmacy reimbursement, we're seeing this as well. This may mean that you have to reimburse, especially independent pharmacies differently than in the past. It allows them to stay afloat, but it definitely could increase the cost to the plan sponsor, especially if you're in a rural area and you're talking independent pharmacies that now will have better reimbursement rates than they had before, but that can increase the cost for the plan sponsor. So we track this very, very carefully, almost daily, to make sure that you're aware of anything that would necessitate a change in your contract or how you set up your plan design, based on legal interest, of course. And then my last slide, Gretchen, if you can flip over, is just, again, kind of why we're seeing so much interest on the pharmacy side. And again, we worry about cost. So a lot of the interest is because organizations, lobbyists, et cetera, are saying, you know, we need to have more generics come to market. They're lower cost. How do we do that? How can we best limit the pharmaceutical companies from increasing cost every year by 4.7%? You know, the interest of reimportation. So again, this is definitely of great concern. There are things that we want to do to manage the ever-growing trend of pharmacy. And so looking at actually changing laws to accommodate this is something that I think we're going to continue to see and we'll have to keep track of ongoing. So I think with that, Gretchen, yep, that is our last slide. I know that we went through a lot of information, but I think we can open it up for questions if anyone in the audience have any. Thank you.
This is Dan. I have a question. It was a tremendous amount of information, very helpful and very interesting. I can only imagine that some heads may be spinning. So where does a cooperative start? How does a business analyze where they are today and where they need to get to?
So I will say it from the pharmacy perspective, maybe Gretchen can comment on medical. One of the first things that I recommend is working with your consulting partner to do, I refer to it as a diagnostic. And it's basically a wellness check on the whole pharmacy benefit. So I like to look at the contract. Is it strong? How, again, has it been negotiated? What's the opportunity to improve price? Then I like to look at plan design. Is the plan design set up where you're able to encourage the best consumer behavior? Are folks using generic medications, you know, if they're available? Are they using a biosimilar instead of a specialty drug? And then I look at utilization management, making sure that drugs like specialty are being, you know, placed under a prior authorization. What does that look like? So it's a full review but it gives the plan sponsor the ability to say, okay, now I'm going to optimize the benefit to the best of my ability. And I'm using my own data to get there. And then we can help them understand what the savings opportunity would be, but also how many members could be impacted. So you can make a really good decision regarding, what the tolerance is for change. And so that's what I would recommend on the pharmacy side.
Excellent, thank you.
Mhm.
Any other questions from listeners in the chat or? Maybe you could just speak a little bit about the process of moving from fully insured to self-funded. How does one even understand that process or get started on that?
Yeah, sure. I'm happy to touch on that. First, we would recommend just doing a full review of what you're currently doing. So if you're fully insured right now, we would look at your group size, what carriers you're currently using, what networks you're currently using, and then look at your risk tolerance and your financials and your ability to move into a setting that could be quite different. And then it would be to start doing an analysis of potential vendors and networks that would fit into your community, that would fit with your employees. We often recommend leaning on your vendor partners and your carriers to perform disruption analysis reports, so you can see the impact on your employees were you to move. In M3's instance, oftentimes our clients will meet with our financial team, our CFO, to see how they handle switching funding and doing something so differently, so they can kind of have a CFO to CFO conversation on what that looks and feels like. And then talking to other groups and what the process felt like. So your broker can advise you and tell you what to expect, but oftentimes reaching out to peers and talking about their experience can be one of the best ways to know how to prepare your team and get in the right situation.
Thank you for that. Well, I see we're up against our hour. Again, tremendous amount of information. I think if there's a phrase that would make people feel a little bit about dealing this, is to know that there are teams like M3 that understand this, that live this every day, that can definitely help our cooperatives move through this. So thank you so much for providing this information. For anyone on the call, if you have further comments or questions, please reach out directly to M3 or contact us here at Cooperative Network. We'd be very happy to put you in touch with the right people. Thank you again to our sponsors. Thank you to our presenters. Thank you to our members who joined us today. I know we have some cooperatives who are not currently members of Cooperative Network, so I would be remiss if I didn't say that I would love to have a conversation with you as soon as possible. But our next webinar, and Cooperative Network has been having webinars on these timely topics once a month. Our next webinar will be at 9 a.m. on June 20th, where we'll return to the insurance field to really discuss property and casualty insurance coverage, which there are some major challenges for both businesses and consumers. And we'll look at it from both sides during that webinar at that time. So with that, again, thank you, Jen and your wonderful team for being with us. Thank you for everyone for joining us today. Have a wonderful weekend and stay in touch.
Thank you so much. Take care.